So welcome everyone. On behalf of the Regional Office of the Association of Academic Health Centers for the MENA region at the American University of Beirut, we are delighted to have you all participate in our webinar today that will be looking at the Kuwaiti perspective of COVID-19, the global pandemic. Our guest speaker today is Ms. Yasmine Rifai, who is the Kuwait government and public sector lead and an assistant manager in risk advisory team focusing on crisis and resilience. Yasmine has a bachelor's degree in computer and communication engineering and over 9 years of experience, including business continuity management, IT disaster recovery management, crisis management, data analytics, and information security. Yasmine managed and implemented end-to-end national business continuity and disaster recovery for 53 government entities in the state of Kuwait. Please join me in welcoming her in today's presentation. Please feel free to submit questions at any time during the session using the chat feature on your screen or in the Q&A box. And Ms. Yasmine will be answering your questions at the end of the webinar during the Q&A. Thanks again for joining us today, and I'd like to welcome Ms. Yasmine. Please go ahead.
Thank you, Ala, for introducing me, and thank you everyone for joining today. I hope you are all safe and well and having blessed Ramadan. Today's webinar will be covering a perspective on COVID-19 pandemic response in Kuwait, as well as Deloitte point of view on government response timeline, scenarios, and what we need to emerge stronger. The agenda will cover for today a background about the situation worldwide and in Kuwait specifically, the timeline of government actions through COVID-19 crisis, Kuwait response on the three fronts, healthcare, economic and business of government, and in the end, how the governments will be advancing to the next normal. Normal life has stopped for more than 1 billion people around the globe. Healthcare workers and researchers are on the front lines fighting COVID-19. And while models and predictions abound, no one can say with certainty what the course of the virus will be. On April 2nd, we had 1 million cases worldwide. On April 15th, we reached 2 million cases worldwide. And then on April 27th, we were at 3 million cases worldwide. Today, we crossed beyond 3.5 million cases. If we look into Kuwait, the first case was reported on February 24th. And then the cases were increasing to reach today 5,278 cases with 40 fatalities. The rapid spread of COVID-19 virus is challenging the governments to act in ways normally reserved for war, depressions, and natural disasters. The pandemic has caused a global upheaval that may endure few months or longer. This is the most consequential set of public policy and mass behavior change actions most of us have seen in our lifetimes. And governments are taking extreme measures to limit the human cost and economic disruption at this point of time. This slide, it's going to show how the government consider and may think about the short and long-term responses to COVID-19 crisis. Governments will pass through 3 overlapping phases during COVID-19 crisis: respond, recover, and thrive as per Deloitte analysis. Ideally, we would predict the dates of transition from one phase to the next, but as Dr. Anthony Fauci said, we don't make the timeline, the virus make the timeline. Most of the governments now are currently in the response phase, as we can know, bypassing many typical procedures like ordering business closures, malls, restaurants, suspending flights. As the immediate danger eases, hopefully soon, governments will enter the recovery phase, and they will be shifting their focus to steep the curve of the economic recovery and to mitigate the broader impacts of the crisis. During the thrive phase, once we have survived the crisis, governments will be considering long-term improvements to respond effectively to future crises. Here, throughout all the phases, governments are contending with the consequences of COVID-19 on three fronts and addressing challenges on three fronts: healthcare, economic, as well as business of government. So far, governments have been dealing with urgent medical and economic issues. And as the weeks pass, the pressure to restore day-to-day government operations is growing, and currently shattered services will need to move into recovery phase and ultimately the thrive phase. In this slide, I'm going to dig deeper how the activities will change over the time on the various fronts in each of the phases that we mentioned earlier. So, for example, during the response phase, which consists of the implementation of emergency measures, which aims at the safety of the people and operations continuity. On the healthcare front, we are aiming to flatten the curve, like all the countries are doing now through social distancing and implementing more and more measures. Boost healthcare system capacity, testing and tracing, overcoming critical shortages on testing kits or mask or respirators or ventilators, provide information guidance, and so on. On the economy front, governments are looking to provide emergency financial support for the individuals and businesses, enhance unemployment benefits, and mandate industrial actions like closures and repurposing of the hotels and so on. Business of the government front, governments are working on closing the offices, using teleworking capabilities, ensure the public workforce safety, surging the capacity due to the increase unemployment and social assistance, bolster the IT and technology. During the recover phase, where the governments will be looking on reviewing the work processes and methods, and as the danger eases, on the healthcare front, we'll be looking and monitoring for the second wave. As we know, it's expected we'll have the additional and multiple waves of this pandemic. And supporting the administration of vaccines and other treatments, assess the financial status of hospitals, health plans, and health system to stabilize for future cost control, and support healthcare workforce post the crisis. On the economy front, we will need to continue support for individual businesses and government, bail out for and enhance support for particular industries that were mostly impacted by the pandemic, start stimulus spending, and maybe initiate tax changes. On the business of government front, we'll need to track and disperse recovery funds, address backlogs, and partially restart certain institutions which are most critical for the country. During the thrive phase, where we will need to revisit the business and operational model for the post-crisis period and capture the future competitive advantages. On the healthcare front, the governments might consider working on reviewing and updating health regulations, implementing new screening measures like smart security at the airports, put in place data infrastructure to track infectious diseases in the future, expand usage of behavioral and insights to prepare for additional disaster or pandemics, and support future vaccination efforts. On the economy front, governments will need to work on diversifying the supply chains, implementing new government business protocols for the strategic supply chains, review strategic national stockpiling, and target economic relief based on the economic vulnerabilities indices and what's going on amid COVID-19 crisis. On the business of government front, governments will need to consider accelerating digital government, implementing universal digital ID, enhancing teleworking capabilities and defining working rules, improving data and anticipatory capabilities, and design systems for resilience. On the coming slides, I'll be covering Kuwait response specifically on the various fronts that we mentioned in the previous slide, starting with the healthcare front. Here, I'm going to be showing some key dates and events and the decisions taken by the government. So if we start by December 31st, where the Chinese authorities were treating dozens of cases of pneumonia and they didn't know the cause of this pneumonia at that time. On January 13th, Chinese authorities have put Wuhan under lockdown. On January 30, the World Health Organization declared a global health emergency. On February 22nd, Kuwait has suspended all flights to and from Iran, even before recording any case of COVID-19. On February 24, 2020, Kuwait confirmed its first cases of COVID-19, which has caused the celebration scheduled for the National Day to be cancelled. On February 27, a new rule that all passengers going out or coming to Kuwait will go through test and a forced quarantine for 14 days if needed. On February 29, all events and exhibitions got cancelled in addition to the Kuwait Bursa. On March 1st, Kuwait government employees went through COVID-19 tests as they entered the ministries. On March 5th, visit visas for all nationalities were suspended until further notice. On March 9, and as the cases evolve, Kuwait government has decided to keep schools closed until March 26. On March 11, Ministry of Health has set 6 days to examine all the passengers arriving to Kuwait after February 26. Also, all flights from and to Kuwait were suspended. All restaurants, cafes, halls, shopping malls were closed until further notice. And still, March 13, Ministry of Interior has suspended all mass transit until further notice. March 19, Kuwait government has issued an extension to the suspension of all schools and universities till August 4 of this year. March 22nd, Kuwait government has imposed a partial curfew from 5 p.m. till 4 a.m. and an official holiday to be extended until April 9th. On March 25th, Phase 1 of the Kuwaiti citizens evacuation plan from abroad has started. On March 26, taxi services were suspended until further notice. On April 1st, Kuwait government started to deport the expatriates in violation of the residence and dropping all their violations for a period of 1 month, and thousands had already left. April 4th, Kuwait recorded its first fatality case from COVID-19. On April 6, there were 2 major decisions. Kuwait government has decided to keep the government entities closed until April 26, and they enforced the complete lockdown and curfew on 2 Kuwaiti industrial areas. On April 13, Kuwait government has announced the start of phase 2 of Kuwaiti citizens evacuation plan, which will last from 19 April till 7th of May. April 20th, Kuwait government has issued an additional extension to the closure of the government entities and updated the curfew to 4 p.m. till 8 a.m. during the holy month of Ramadan. In this slide, I will cover some major highlights taken by Kuwait government on the healthcare front. So Kuwait has prioritized the human factor and implemented very strict precautionary measures even after its first cases were recorded in late February. So Kuwait has donated $40 million to World Health Organization to support the fight against coronavirus. Kuwait was placed first in the world also from precautionary and preventive health measures taken by the Ministry of Health for number of cases per million people. Kuwait initiated a massive and the biggest operation to repatriate 40,000 citizens stranded overseas amid COVID-19 pandemic. All non-cargo flights in and out of Kuwait were suspended as of March 13, making it the first Gulf state to ground all passenger flights. Ministry of Commerce and Industry launched online appointment for grocery shopping to enable the consumers and book the appointments to shop at the co-ops in their area at specific dates and times. And this also helped to monitor and locate the commodities and regulate the prices. So also Kuwait was the second country in the world to stack the PCR testing kits even before its first case was recorded, which helped the Ministry of Health during the fight against COVID-19. In addition to that, multiple 5-star hotels and resorts were repurposed by the Ministry of Health and with the support of other entities like Ministry of Defense, Kuwait National Guards, and Ministry of Interior and Oil and Gas sector, where also where international fairgrounds were used as a field hospital, and many field hospitals were built to increase the capacity from 15,000 to 25,000 beds and more than 2,000 ICU in Kuwait. Now we move to the economic front. I will start by highlighting highlighting the economic impact on multiple sectors in Kuwait as announced by the Central Bank of Kuwait. Here it shows the number of or percentage of reductions of the yearly income during 2020 in light of expectations for closure extension from 8 to 12 weeks. So if you consider an expected closure extension from 8 to 12 weeks, these sectors will be impacted by the percentages shown in this slide, and the subtotal of the affected sectors, the subtotal of this percentages will be summing up to 15 to 30% across multiple sectors like construction, real estate, transport and storage, manufacturing. And each here I'm showing also the contribution rate of these sectors in 9 oil GDP. And also these percentages sum up to be 42% of these sectors. In the longer term, the challenge is restarting the economy and helping those most affected by the pandemic. Kuwait government has announced a slew of fiscal measures with the aim to help the economy. Here I'm going to list some of these measures, like the limit for contactless payments was increased to 25 KD from 10 KD, and also fees on point of sales devices and ATM withdrawals was suspended for 3 months. There were multiple monetary and liquidity stimulants. Also, the Kuwait Banking Association announced moratorium period up to 6 months on bank loans, including waiver of interest and charges for retail clients and SMEs. And in the next slide, I'm gonna go to Central Bank of Kuwait measures, where Central Bank of Kuwait has announced multiple measures in support of the government's effort to help the economy amid COVID-19 outbreak. Some of these measures on March 12th, CBK has cut the discount rate from 2.75% to 2.5%. On March 16th, CBK has cut again the rate to a historic low of 1.5%. Repo rates were reduced overnight, over 1 week and 1 month to 1%, 1.25% and 1.75% respectively. On April 2nd, multiple decisions also were taken, including capital adequacy ratio was lowered from 13 to 10.5%. Risk weight for SMEs lowered from 13 to 10.5% as well. Limit of financing were increased from 90 to 100%, and loan to value ratio was increased for properties. The last front to cover is the business of government fronts. In this slide, I'm going to show multiple initiatives that were implemented by multiple government entities here in Kuwait, including social responsibility, where a fund was established to receive financial contributions from locals and support the government's efforts related to the outbreak. Ministry of Interior also implemented volunteer registration for civil defense on their webpage. The 3 mobile companies in Kuwait offered every subscriber 5 GB daily usage for free for a whole month. Also, there was other initiatives to enable government employees during COVID-19 crisis, including remote work initiative for the government sector initiated by the Central Agency for Information Technology, CATE, to equip the employees and to maintain productivity and ensure business continuity. There was also another one, which is the online training portal to reduce the impact of COVID-19 on the government employees. Also, from educational perspective, there were some educational solutions introduced by Ministry of Education, like Kuwait e-learning portal that provides all that's needed for the educational process to be achieving its desired goals amid COVID-19 pandemic. Also, KFAS, Kuwait Foundation for the Advancement of Science, has initiated emergency resilience program in response to COVID-19. Also, multiple applications and the platforms were initiated and implemented to support the healthcare system, like official website for COVID-19 updates in Kuwait, corona.e.gov.kw, to provide official insights on the cases in Kuwait and avoid fake rumors, contact tracing app, Shlonik, to support the self-check-in mechanism for quarantined patients and vital reporting and communicating tools with the MOH medical teams. The national also there was the National Corona Psychotherapy Program. It's a platform to seek help and psychological counseling by a dedicated team of volunteers. Last but not least, there was also some platforms and applications developed to support the government to combat COVID-19, like e-form for curfew pass for medical emergencies, digital identity developed by the Public Authority for Civil Information, PASI, food shopping appointment reservation system, as I mentioned earlier, to regulate the shopping for food in the co-ops by the Ministry of Commerce and Industry, with you or Ma'akum platform to support the repatriation of the Kuwaiti citizens from abroad. Eventually and hopefully the crisis will end and life will return to normal. But what if it's not like before? We are in uncharted waters, yet we may be on the cusp of a long-term transformation, and COVID-19 has accelerated the timeline for the future of work. We have covered main activities to be included in the response phase. Here I'm gonna elaborate on some key considerations to be taken by the leadership in the governments and the recover and thrive phases. During the recover phase, as the immediate crisis recedes and governments begin to return to normal conditions, government leaders may consider focusing on communicating across boundaries, like between the multiple government entities, as well as between the government and the private sector. Also, while the focus may shift toward the economy and the business of government, we need to ensure that data-driven vigilance must continue for additional waves of the virus do not catch regions unaware. During the thrive phase, when the health crisis will be over, leaders may consider embracing the longer view and ensure that the opportunity to invest in resiliency and improve in the public sector will not be wasted. And as we noticed, the more digital and citizen-centric the government is, the better for those it serves. In this slide, Deloitte and Salesforce have joined forces and concluded 4 distinct scenarios that could emerge in the world based on the current trends and the critical uncertainties. So if you see in the chart on the right side, the x-axis reflects the severity of the pandemic, and the y-axis reflects the level of collaboration between and among the countries. So here, multiple scenarios could emerge depending on the severity of this pandemic and the level of collaboration within and among the countries. The lower the impact and the significant the collaboration is, the scenario that will evolve will be the passing storm, where the government will be able to contain the virus. There will be some lasting repercussions, like affecting SMBs and lower and middle income individuals and communities, but it will be able to contain the virus. The more the severity of this pandemic and the less the level of collaboration, there will be 2 main scenarios that could evolve: good company and sunrise in the east. Good company will be in case we'll have less severe pandemic and more collaboration between the countries, where governments will struggle to handle the crisis alone. However, large companies will be stepping up as a key part of the solution, and there will be acceleration towards stakeholder capitalism. For the sunrise in the east, it will be in case of a more severe pandemic and less collaborative level between the countries, where China and other East Asian nations might be more effective in managing the virus and take the reins and primary powers on the world stage. And the extreme case will be in case this pandemic will go for a prolonged period of time, and the level of collaboration within and among the countries will be marginal. In this case, the governments will be adopting isolationist policies. There will be shortening in the supply chains and increasing of surveillance. In this slide, I'll cover how these scenarios will illustrate different ways in which the world could unfold after the crisis on multiple levels, like society, technology, economy, environment, and the politics. So if we start by the passing storm scenario will be affecting the society in a way it will rise as there will be more appreciation for interpersonal and familiar relationships, as we are witnessing now. Technology will stay on course. Economy will enter an extended recession, and there will be a chance of increased income inequality. In the environment side, it will be renewed, and we will see hopefully global collaboration provided and hope for a progress. Politics, it might gain trust, and international organizations like WHO will grow in relevance. In case of good company scenario, the society will be maintained. However, it will shift to be more purpose-driven. The technology will take the center stage, and large companies will be driving solution, especially in the areas of health tech and biotech. And the economy side, it will be disrupted, and we will see growing concentration of power among the large companies. From an environment perspective, it will be mixed between sustainability-minded companies investing in renewable energies. Politics, they will be partner up with the large corporation because they will be key part of the solution. If we have the sunrise in the east scenario materializing, the society will be shifting to an increased emphasis on the good of the whole. Technology will be accelerating as more data sharing will be allowed and advancing in AI and other tech capabilities. From economy perspective, it will be shrunk, and due to the prolonged nature of the virus, the environment will be de-emphasized and economic recovery will be prioritized. Politics, it will be looking in the East for guidance, and Asian countries will be effectively managing the virus in this scenario. And the last scenario, the lone wolves, the society in this case will fall as the xenophobia and suspicion of others will become the norm through the severity of the pandemic and the prolonged period of the crisis. Technology will be divergent, as will be different markets, and they will be focusing on advancing the surveillance and control measures. Economy will be left in turmoil in this case, as global supply chains will be disrupted, and the environment will decline as countries will shift toward energy independence. And here I would like to highlight that environment is one of my dearest causes to me, and I hope we use this chance and make it a turning point to appreciate our environment more, and maybe progress in a way that will be enhancing the environment. And last but not least, from politics perspective, in lone wolf scenario, there will be adoption for isolation, and each country will be attempting to contain the virus within itself. The journey ahead will not be easy. We are witnessing a triple crisis targeting our health, our economy, and our governments. But the governments have the tools to guide the society from crisis to a better future. And there are multiple chances to enhance, like digital capabilities, by implementing digitally enabled future of work, including business processes and back office functions, focus on data protection as in an elevated threat environment as we witness now. We will need to focus on reducing the security risks and disruptions to business operations. From financing perspective, we will need to maintain robust financial forecasts, stress test corporate models and capital structure, and build resilience into operation and financing. Also, as we see now, we will need to rework our employment arrangements and reflect on the next normal and consider shape of business model to adopt maybe for a remote first strategy. From supply chain perspective, we will need on restructuring our supply chain and implement solutions that improve end-to-end visibility, synchronization, optimization, and agility of supply chain. At last, the sustainability. It's very important to reflect on COVID-19 lessons learned and develop ecosystems of the future to implement organizational design for better resilience and flexibility. Most importantly, I want to highlight that the transition will not happen overnight, but the opportunity and technologies to enhance our organizations and our lives are more powerful than ever before. And we need to look for ways to harness these technologies and and opportunity for the benefit of our countries and build a better new normal. That's it from my side. Any questions?
Thank you, Ms. Yasmine, for putting this together. That was excellent and very informative. We appreciate your time and your experience and insights on this pandemic. I'm going to go ahead and open the floor for discussion. If you have a question, please type it in the Q&A or in the chat box, or you can raise your hand and I can unmute you so you can talk. We have two questions already from Rami Al-Sahar. What is your view of the reopen in Kuwait, and is there any size impact of business in Kuwait, any numbers?
Actually, if in Kuwait specifically, still it's not clear how things will evolve, as the number of cases, like sometimes they go up, sometimes they go down, and hopefully we'll get worldwide. We are facing this challenge, and it's like the first time we go through this crisis and this type of pandemics, and we are hoping that the research is going throughout like maybe more than 300 companies around the globe to find a vaccine. We will get there as soon as possible, and we'll be able to move to the recover phase and ultimately to the thrive phase of this pandemic.
We have a question from Dr. George Ghanem. I will unmute you so you can talk.
Okay.
Hello.
Hi, Dr. George.
Hi, Yasmina. How are you? Thank you for this beautiful review and different scenarios. I was wondering the scenario for unfolding during the period of unfolding after the pandemic is beautiful, and certainly it triggered a lot of discussion. But did you do any at Deloitte any scenario for the next pandemic? The different scenario on how should we react immediately to a new pandemic worldwide? What is the best scenario to shut down everything, shut down the world, shut down partially a different region by continent? I don't know, but is there any scenario on how should we behave during the next pandemic?
For this specific pandemic, like things are evolving based on how the cases are evolving around the globe. Like as even at Deloitte or other like consulting firms, we are having more material as things unfold, and as the pandemic severity clarifies. So till this point of time, we are the researchers are expecting additional waves of coronavirus or COVID-19 pandemic, and for the next pandemics, I believe it will be, as I mentioned in the next steps, that we need to ensure that we are ready for the next pandemic from different capabilities, like digital capabilities, and maybe remote working will become the next normal. Also sustainability, restructuring the supply chains, all this will help the governments to be more prepared for the next pandemic or the additional waves of coronavirus itself.
Okay, thank you.
Thank you, Dr. Ghanem. We have a question from Abdulrahman Al-Jassim. How do you think the With You initiative will impact Kuwait COVID-19 counter plan?
The
With You initiative?
معاكم?
Yes, I think yes.
It will help Kuwait. Can you repeat the question, please?
How do you think the With You initiative will impact Kuwait counter plan?
Counter plan, I didn't get.
The COVID-19 counter plan. Abdulrahman, if you can type your question clearer, we can, Ms. Yasmine can answer it. Another question, how is the Kuwait economic situation comparing to other Arab countries during this pandemic?
I believe Kuwait is taking multiple measures that on multiple fronts, from economy perspective, healthcare, and business of government, and most importantly, Kuwait has prioritized the human factor and is doing all that's needed to support the businesses and the citizens in this crisis.
Okay, I'm gonna unmute Abdulrahman.
Abdulrahman, yeah, please.
Hi, can you hear me?
Hi, Abdulrahman.
Hi. What I mean is, how would with your initiative, like considering they are bringing a large number of people to Kuwait, impact how Kuwait is handling the COVID-19 crisis inside the country? Like, would that make it worse? Would they be able to control it? What do you think of that? That's
I believe, as I think the WHO presidents once said, like they set the regulations and they tell some of the things that governments need to follow, but it's up to the governments to choose what they need to follow. So here it applies the same concept. Like the government is setting all the regulations, is setting all the rules for the citizens to follow and to control the repatriations effort done for the citizens coming from abroad through the bracelet to track them and with you platform. And now it's up to the citizens to be responsible to abide by these regulations, to abide by these rules, so they can have full control over the situation and not impact it in a bad way or something, as they are controlling it to the laws of quarantine 28 days. And we are hoping that the citizens will be responsible to abide by these rules and measures enforced by the government, so it doesn't counter the efforts that are taken by the government here.
All right, thank you very much.
You are welcome.
We have a question from Lavi Anderson from Brazil. She says, I'm a doctor. We have been facing a very challenging health condition in the country nowadays. Did your country have to acquire any kind of extra help in terms of safety devices for the health system?
Here it was, it was in Kuwait specifically. There was import for equipment from China and devices and even testing kits and even like medical support from India. And now we have Chinese experts coming to support the government on some advices regarding the measures taken here, or maybe a chance to improve or enhance whatever is done by the government and the healthcare authorities.
A question from Tariq Al-Dawood. What do you see the role of risk management professionals during this pandemic and afterwards?
I believe it's very important that that we like update whatever we have done to accommodate for the new risks and to the new regulations or procedures that could be taken and lessons learned out of this pandemic, and to make sure that we have in the crisis management procedures and the risk management procedures, whatever needs to be done from this perspective based on the lessons learned during this crisis.
We have a question from Hamad Daoudi. From country to another, the capability of following the strategy you have initiated is different. What's the average duration to recover and go back to normal? Especially not all citizens will take that seriously.
As I mentioned earlier, like we cannot predict the transition between the phases I mentioned, like between respond, recover, and thrive. It's not predictable how much it will take time to be transitioning between each of these phases, as the virus and the circumstances surrounding the virus are not clear. And we are, like, as I said, we are in uncharted waters, and so it's not clear how each country, like, and as we saw, like, each country is transitioning from are still under respond phase. Only maybe China and South Korea and some other few countries moved to the recover phase, and we see more and more cases in other cities, like, for now. So it will be depending on the timeline that will be drawn by the virus itself and how things unfold and how quickly we will have a vaccine and the cure.
Dr. Ghanem has another question, so I will unmute him now.
Okay.
Yes, Yasmine, I was wondering if we have some homogeneous data from the region, from the Middle East and Gulf region on every country in order to, after the pandemic, to have some kind of a study of comparative study between how this pandemic has been tackled at each phases and which country adopted the right measures and in different phases. I don't know, for example, for here in Lebanon, I have the impression that we may have adopted some good measures at the beginning, but now there is a complete loose attitude. Is there any way to have this kind, collecting all these data and making some comparative figures?
From my side, I can provide you the data that I collected here for Kuwait and other regions in the Gulf countries. But I believe also the economic situation and the disruption that we are facing in the economy is what's controlling maybe the rushing in opening, like in the case of Lebanon specifically, to open the country again, to avoid further economic disruptions. But I can definitely support on providing the data that I have.
Okay. Thank you.
We can collect this data with the regional perspectives and share it with our members.
Yeah.
Excellent.
Okay, any more questions? We have one more question from Ahmad Diab. After this pandemic goes over, a new strategy or strategies should be followed and applied worldwide through governmental cooperation under WHO umbrella. I think it's just a comment.
Yeah.
If you want to comment.
No, it's true.
Okay.
Definitely, there will be need to change some strategies.
Anything you would like to add?
Thank you, everyone, for attending today. Any additional questions?
I think one more. No, we have a lot of positive feedback. I will forward them to you. Thank you for your great presentation and for contributing to the effort and sharing your experience and observations. We have one more question. What's your plan to make sure that the global organizations would implement your initiation plan?
The global organization?
Organizations, yes.
I didn't get the question. If someone can talk and clarify.
Can you, Mohammed Audi, can you type your question in a clearer way? Yes, we will publish the recording online for anyone who wants to watch it again.
No further questions?
No, I think that's it. We have one more question. Any idea what the fate of expats living in Kuwait and the GCC countries will be?
I personally hope that that all of the countries around the globe will be able to be in the recovery phase soon, and we will be able to, because there is a lot of efforts by the researchers and the scientists and the doctors around the globe done to get a vaccine and to resolve this crisis at the earliest. So we hope we will get to this to the recovery phase as soon as possible, whether in the Gulf countries or around the globe. And the expats, it's like the case of everyone, whether the citizens or the expats. We are waiting for to unfold this crisis and to know what's going to happen on all fronts, and especially the healthcare front.
Okay, what Muhammad Audi meant, how would you work with the health organizations so that they can have access to your plan and ideas?
I believe that all the governments are collaborating and cooperating with the WHO specifically now, since it's the most global organization in relevance of the situation. So all of the governments around the globe are collaborating and trying to provide the data to make sure they foresee what needs to be happening on the next stages and phases.
In your point of view, why in some Gulf countries the number of cases was higher while they made the same regulations as the other countries, for example, in Saudi Arabia and UAE?
Like Saudi Arabia and Emirates. Just a second.
You can see it in the Q&A box.
Yeah. I believe the cases, maybe the number of cases was a bit higher because the measures took some time to be implementing strict precautions measures, but I believe now all the countries in the Gulf like UAE, Saudi, Qatar and Kuwait are doing very good on testing and the tracing efforts to isolate the cases and make sure they are identified, and they are taking all very strict measures at this point of time regarding the pandemic and COVID-19. And again, it's the responsibility of the citizens to be abiding by the measures enforced by the governments, whether in Gulf or around the globe.
Okay, thank you everyone for participating. You can email your questions to international@ahcdc.org, and we will forward them to Ms. Yasmine and get back to you. That will conclude our webinar for today. Thank you everyone for participating, and thank you Yasmine for your effort.
Thank you everyone. Thank you.
Thank you.